Hi guys, this is Ava from Bay Harbor Med Spa, and I'm going to read a message, an email that I got. Uh, it's a lengthy email, but I think some of you might have the same question and you wonder what can be done. So I decided that I'm going to read this email. I'm actually going to shrink this and look at the email. So here, hi, my name is so and so. I am so tensed about the one or two pimples that always break out my skin. I have been using many products like tretinoins, clindamycin, which is an antibiotic. Every gel worked for a time and then it doesn't work anymore. I started taking beta carotene and my skin was fine, and again I have two pimples on my face. Sometimes they are so painful, sometimes there is just a redness on the skin, little elevation, and then scar that takes so long to go away. Please tell me. Also prescribe me any gel cream that would help the scar go away. Okay, so guys, here is my suggestion. Not knowing what this person condition is and how young the person is. Wait, I have to put the fan on. How young the person is. I would say that I assume that this person must be in their early 20s. It's just my assumption. And she's only talking about two pimples. So yes, she took antibiotics, yes, she used gels, and everything helped only to an extent. My analysis would be to all of you out there, the reason that medication can only help, or topical medication only partially, is number one, because number one, your skin is congested, because none of you out there talk about abrading the skin, exfoliating, removing the top layers of your skin, cleaning the skin, going for facials, doing extractions. None of you out there talk. All of you guys are talking about slapping 1, 2, 3 things on your face, and you guys really believe that you can perform miracles, that anything that you put out there can perform miracles. Also, the question that she placed to me by asking me with very true sincerity that I should prescribe her a gel, or I should prescribe her anything that could help to get rid of these two pimples. And then she's describing that the pimples sometimes are not big, but they are inflamed, sometimes they are elevated, sometimes they are not, sometimes they are red, and sometimes they are painful. Well, you guys, you know what that is. Number one, that is subdermal inflammation. And categorically, I will say that what would really have to happen is like this. Anybody that suffers, like this young lady, from breakouts here and there, and from conditions like she describes, that she is taking medications, took some topical antibiotics, and then the breakouts, once she stops, are coming back. Look for a solution, not a band-aid. What you guys are doing and what you guys are looking for is a band-aid. You want me to put a band-aid on your wound. You want to go to a doctor. You want to go to a pharmacy. You want to buy a band-aid, and you believe that when you put a band-aid, the problem is solved. And you're absolutely wrong. We have to come to the core of the problem, and we have to address the core of the problem. We know that it's acne. We know that you have an inflammation. We know that it is an internal situation that's coming to the surface. So band-aids, by say, aka using topical antibiotics or tretinoids, is not a solution if, and I specify if, you don't go for facials, if you don't exfoliate, if you don't get extractions, if your skin is still congested, if the oil, if the sebum, if the dirt that's under the skin is still trying to come out, but it can't because the surface of your skin is congested, No medication in the world will solve your problem. No band-aid. So remember, we want to take off the band-aid. No more band-aids, okay? We want to address the issue. The issue is skin is congested. Skin is something that's living. Remember that. Skin is living. Skin breathes. You know, if you look through a magnifying, or if you take glass and you look very carefully in a magnifier, you would see skin is porous, it has holes. Your skin does breathe, your skin takes oxygen in, your skin releases heat. So the skin is a living thing. The skin is only a cover-up to your whole body, number one, and number two, it is the cover-up of what happens underneath. But in order for you to have smooth, clean, clear skin, you have to get rid of what's inside. How do we get rid of what's inside? We try to exfoliate. So the first thing I would say, try to go and find a place that does acne facial, that does oily skin facial, that does microdermabrasion facials. That is the number one thing, because you want to exfoliate and you want to have your sebum, your oil deposits, your blackheads removed, your whiteheads removed, so that the skin can breathe. If that is not possible, and that's choice number one, if that is not possible, then the next best thing to that would be to use a crystal microdermabrasion scrub, so that you can scrub. Why a crystal microdermabrasion scrub on anything else? I'll tell you why. Because the microcrystals are very, very fine. It's like sand. Very, very fine. So the particles of the crystals are like salt. Very, very fine, very, very small. And they are very hard because it's a mineral. So when you take the microdermabrasion and you abrade the skin, you scrub it at home properly, you are able to slough off the top layer of the skin, or at least help to open some of the pores. So microdermabrasion would be one way to go, if you cannot go for a facial or for microdermabrasion, to unclog the skin. Second thing to unclog the skin would be an AHA mandelic acid product that would help to decongest the skin, remove the congestion, if gradually removing the skin. So a combination of crystal microdermabrasion and a combination of a mandelic acid together, you could achieve what I am talking about, is getting rid of the band-aid and allowing to slough off the top layers of the skin, allowing the pores to open, allowing the oil, the deposits, the gook that's inside your skin and under your skin to come to the surface. That's would be the next best thing to a professional facial. And then, and only then, can we talk. Once you do this, and it might take you weeks and months to get rid of everything that's underneath. And somewhere I made a video that I showed how to do very gentle extractions if you absolutely cannot go to a professional person. Then after you do microdermabrasion, after you do AHA mandelic acid, after you allow your skin to be exfoliated and you allow whatever is under the skin to come to the surface, and then you still have some blackheads, then this is what I would suggest to do. After you do microdermabrasion, then what I would suggest to do is, wait, I have to bring tissue. Oh, yeah. Here's what I would do. Guys, look. With very clean hands, and you can take 2 tissues, okay? You wrap the tissue around your finger like I did, okay? Clean tissue. And you would go like this, very gently. You would squeeze with clean fingers. No nails. Oi, 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 no nails. You hear me? No nails, because you will leave marks. So either with, if you have absolutely no nails, if you have nails, cut them, get rid of them. And then gently squeeze. After you did microdermabrasion, gently squeeze and push bring to the surface, but don't kill your face and don't kill your skin. Bring to the surface as much as possible of the oil deposit, whether it's on your nose, whether it's on your chin, whether it's on your forehead or on your side. You do that. Then after that, you should clean it with either a acne lotion, a toner that would clean and balance the skin, or it depends on the skin condition, or an AHA, a mandelic acid toner that would also help to clean it and continue sloughing it off, decongesting the skin. But that really depends on your skin condition. What you should not, and listen very carefully, what you should not, absolutely do not do. If you have a pimple that is red, that is inflamed, that is painful, girls and boys, don't touch it. Do you know why you shouldn't touch it? Because in many cases you won't be able to get anything out except maybe pus, have it open, infection, germs, bacteria can enter it. Even if you do it with hands that are not clean, or you are in an environment that is not clean, and you will create a much bigger problem. For the pimples, for the inflammation, like this person described, that she has these pimples that are invisible at times or very flat, but it's all red and it's all inflamed. The best thing to do is either you can get some prescription antibiotics orally to take, or you go and see your doctor or a dermatologist, and if the inflammation, if the top of the pimple is really hard, very, very hard, then an injection of steroid, of cortisone, of corticosteroid. A doctor puts a little needle in, injects this corticosteroid, and that steroid will reduce, shrink the inflammation. And within 3 days, all that redness, all that hard pimple that is there will shrink and disappear. Do not try, and I emphasize, do not try to squeeze it, because you can't get rid of the inflammation. It's an internal situation. It's something that's happening in your body. So this is what I would suggest. No band-aids, no more band-aids. What we want is either go for a professional facial and get professional extractions, professional microdermabrasion, professional treatment to help you to clean and clear your skin, and then you can use the microdermabrasion acne product line, gels, or the mandelic AHA acids or treatments. If you can't do that, then you should try to get the microdermabrasion scrub, the acne solution, the acne product line that would clean, and if necessary, get the AHA mandelic acid, which you can use on a regular basis to decongest and clarify and lighten your skin. But this is only if you cannot go for a professional. I really would always prefer that you see a professional person, so that you don't make some mistakes. But if you are not able, then the next best thing would be to use products that would soothe your skin. If you want to know more, you can also read at the bottom here, and you can go to my website, read the information that I have out there, and then if you are still in the unclear, you can contact me. So that's my suggestion. I hope that I clarify this, and that you will understand that putting band-aids on a problem is not solving it, it's just masking it. The problem still is there. This is why the pimples are still there. This is why when you take antibiotics, this is why when you take tretinoids, this is why when you put gels, you're only masking it. You're only on the surface, and the moment you stop using, because you never address the issue why you have it. Get rid of what causes it, okay? So band-aid off, going deep in, treating the skin, either clinically or you do it at home. You have a lot of tools now that are available to you, and that will help you. So until next time, ciao guys. Thank you. Bye-bye, Eva.